Hello and welcome to Notes 3.5, where we're going to talk about another type of experimental design called randomized block design. Okay, so Mr. Dobrovich went over in the video about completely randomized design, which is very similar to this idea of doing sort of like a simple random sample. You're just sort of letting, a coin flip or, numbers out of a hat, random digit table, whatever, sort of decide like who goes into what treatment groups. And there could be a small problem with that because just like with simple random sample, it's possible that you end up with sort of a disproportionate grouping for these different treatments in a way that might affect sort of your ultimate results there. So for sampling, when we did that, it's like we took a simple random sample and then we found out like, oh, it's just a bunch of, people above a certain age in this group, or it's just a bunch of freshmen that are in our group, or, whatever population we're dealing with. We had a way of fixing that. So if you recall, when we were talking about sort of sampling Fremont's population, if we were worried about like accidentally getting a bunch of lowerclassmen or upperclassmen from a simple random sample, what we can do is divide our population into something called strata. That's basically homogeneous groups. So like in our example there was like we'll separate them into freshmen and sophomores and juniors and seniors. There are other groups, obviously, that it might make sense to sort of separate them into as well. And then after that, we perform something called a stratified random sample. So break them up into the strata, and then you just sample randomly an SRS from each of those strata. So we could do something similar here. If we're interested in doing an experimental design here, and we're worried about maybe accidentally in our treatment group sort of accidentally putting a particular flavor of a subject all in our treatment or all in our placebo or whatever, we can actually kind of fix that with something called blocking, okay? So if blocking can happen, if you sort of notice that there's some obvious and uncontrollable factor. Uncontrollable is important, so it's not something that you can control. I can't control what grade level a person is in. I can't control gender. I can't control age. So these would be things that you might want to think about blocking for if it might be important, because maybe it turns out that that particular factor can influence the results of our experiment. So what we can do is we can divide the subjects first into blocks, much like we did with the sampling of strata, and then we can sort of randomly assign within that. We just kind of go into just like with stratified random sampling, that we would go split it up, and then we do an SRS within each of the strata. Here, what we'd want to do is split up into blocks and then create little miniature experiments within each of them. And so this is what we call a randomized block design. And it allows us to see more clearly the true effects of the treatment, since subjects from each block will proportionally undergo each treatment. So by blocking it up, we immediately are able to sort of get a proportional breakdown here. We avoid that issue of maybe it's just a bunch of men in getting a particular treatment, or people of a certain age. So that's really important for us if we think it can affect things. The reason we really want to be worried about this is something called a confounding variable, okay? So blocking is a great way to diminish something called a confounding variable, which is when the levels of one factor are associated with the levels of another factor, okay? And thus their effects cannot be separated. We sort of talked, I think, a little bit about this in our bivariate statistics when we were talking about lurking variables, can't always assume just causation for things, and that there might be a third variable, something else going on. That's what we want to try to avoid here, is that we want it to be that we really believe that the treatment is the reason we're seeing results. And so at the end of it all, if it turns out, we look at this and we go, oh, look at that, the treatment group actually was showed results, had a statistically significant difference from the placebo group, the control group. Could we honestly say for a fact that we know that treatment is probably the reason we're seeing that? Well, if there's other factors at play that might have accidentally happened. So, for example, let's go back to that experiment that Mr. Dobrovich was talking about in the last video about what if we talked to clinically depressed people and we started looking into treating their depression in different ways. We're going to sort of go with the idea of it just being about using like talk therapy, as that there was, once we get talk therapy mixed in with maybe some other things, it gets a little complicated really quickly. So I wanted to try to keep this a little bit more straightforward. So it's like, do they have talk therapy or not? Well, what if some therapists believe that age can play a huge factor here, okay? What if age can play a huge factor? Well, this could be a problem here, okay? So without blocking, we could accidentally give a disproportionate number of younger individuals the real treatment, okay? And then if that's the case, a lot more older people are in the placebo treatment group, and that could be a huge problem here. At the end, if we were like, hey, the treatment worked, could we really say that with like seriousness? Or could it be that like, you know what, it turns out age is a factor. It turns out the younger you are, the more likely therapy does work for you. Older people, it just doesn't work as well. So if that's the scenario, if that's the case, then us not blocking is a huge, huge problem. So we want to maybe, in this particular example, try to block for age in this case. That might be very helpful. So let's go ahead and kind of go through our questions we ask ourselves in order to sort of make sure that we are coming up with the best design possible if we think age might be an uncontrollable factor in all of this. So let's start with the population of interest. So population of interest, if you recall, are people with clinical depression. Okay. And so from there, we've taken a random sample and we got 108 volunteers. We're just going to stick with the same numbers here. So what kind of design type? I added this up here at the top here. Design type, completely random or randomized block design? Mr. Dobrovich went over completely random, but if we're interested in possibly age being an uncontrollable factor, then we should think about doing a randomized block design. And our blocks are going to be splitting up by some sort of maybe there's a good reason to break it off at a particular age. In this case, I actually was looking this up because I wanted to see, like, is my thoughts on this actually kind of true? Turns out there is some thoughts. So there is a group that is 60 years and above, and a group that is less than 60 years old. And so that's what we're going to do. We're going to take our 108 volunteers. We're going to figure out how many of them are above the age of 60, below the age of 60, and then from there, come up with our design here, okay? We'll say for the fact of this problem here that there are 80 people that are below the age of 60 years old, and there are 28 that are 60 years or above. I'm just making up these numbers. Usually in the problem, they would sort of tell you. I didn't tell you the problem. All right, so what's our factor, and what's going to be our factor levels? Are we going to do some blinding here? Well, we're going to talk about talk therapy. And we're just going to go talk therapy, yes or no. We're not going to do how many times per month. We're just going to say that there is talk therapy or there's not talk therapy in this particular case. And blinding, this was discussed a little bit with Mr. Dobrovich. It's a little bit tough with talk therapy maybe to do blinding, but in this case, but we did sort of discuss a little bit about how like you could do a fake therapist who maybe just reads from a script. So the different treatments in this particular case are just the yes or no. So I'm going to sort of skip that and move on to our diagram to help us out here. So what would our diagram look like here? Okay, well, let's take a look. What we would do is we would have 108 volunteers. Okay. And then what we would do here to start out with is we would block. So we're going to separate into 2 blocks right away. So this is a block, and this is not a splitting randomly. This is us splitting non-randomly by age, okay? So we have, in this case, greater than or equal to 60 years old. Okay, that was 28 people in that group. Oh, I should stick with my color coding, shouldn't I? And then in the other block, we have under the age of 60 years old. And that was 80 people. Okay. And then from there, we're going to now do individual, completely randomized experiments in here. So we're going to use here an SRS to separate our 28 elderly people here into the 2 different groups. And then we're going to do the same thing here. We're going to do an SRS on these 80 slightly younger people here. So we're going to do yes talk therapy, no talk therapy. And then same thing here, yes talk therapy, no talk therapy. Okay, and then we can sort of say here that we probably would split this up as 14 and 14 randomly, here 40 and 40. If you don't have an even number, it's okay if you have a slightly different numbers, like it's okay if there was 79 people, it's okay to go like 40 and 39. That's totally okay to be off by just 1. Cool. And then after this, there's some really cool things. What we get to do is we get to compare sort of the results inside each of the blockings. So we'd be able to look at and go like, okay, so these 60-year-olds that did talk therapy compared to those that didn't do it or had the fake therapist, sort of what are the results that come out of all of that? Or same thing with those that are under the age of 60. But then we also get to sort of see the difference in the results across the blocks too. That could be kind of interesting too, is to sort of see like, oh, well, like did 60-year-olds react to the talk therapy in the same way that those that are below the age of 60? And those are interesting questions to explore as well. So you can sort of do a comparison in between the blocks as well. But in the end, what we end up doing is compare severity of depression. As Mr. Dobrovich said, we're not actually licensed therapists. So like, what are those metrics? I don't know. I'm sure there are some that we can sort of do, but that would be the idea. So there you go. That is block design, where you start out with separating your volunteers, your subjects, your experimental units. Don't call humans experimental units. It sounds weird. First, based off of some uncontrollable factor, like age, like gender. Those tend to be the most common ones, but there can be other things like, like what math class you took last year, I don't know, like income. There's a lot of different things that are out of your control as an experimenter that you might want to separate it into. All right. So you're going to try this one. I'll get you sort of set up and talk you through a little bit of this, but I want you to answer these 4 questions independently and have this checked off by your classmates and your teacher next time. So here we're going to talk about nurse practitioners. So nurse practitioners are nurses, but they have advanced qualifications, and they have a lot of the same sort of responsibilities as a doctor, a primary care physician. So the question is, are they just as effective at treating patients as doctors? I mean, at least patients with chronic conditions here. So let's say we were going to do an experiment. We grabbed 1,316 patients who had been diagnosed with asthma, diabetes, or high blood pressure. Within each condition, patients were randomly assigned to either a doctor or a nurse practitioner. The response variables included measure of patients' health and their satisfaction with the medical care after 6 months. So first question, what are the blocks in this example? Are they the different diagnoses or are they the type of care? And make sure you write down how you know that. So pause, think about it, and write it down. A little hint to you for that one is remember that blocks are uncontrollable factors. Okay, and then the second one here, why would randomized block design be a better way to do this than just a completely randomized design? What are some pitfalls you might fall into if you did just completely randomized and did not block? Next one, you're going to draw the diagram for this experiment. There are some numbers missing from the problem to be able to do a complete one. So either make up numbers or just don't worry about the numbers when you get down into the breakdown. And then lastly, thinking about sort of the population that we're discussing here, would it be fair to generalize the results of this experiment to all patients? Why or why not? Awesome. So make sure you answer very thoroughly, some good responses there, so that way you have something to chat about with your group mates. And we'll see you all when we see you.